Yes, we are about to go live. Okay. Hello, good day, everyone. Good morning and good evening, by the way, because in our country is almost about to be evening, 6 p.m. over here, and I am going to talk today to Dr. Nicole, and she's from New York, and she's actually just started her morning rituals, and that is 9 a.m. over there. And Dr. Nicole is a psychologist, and she did her PhD from she did her PhD already, and now she applied for postdoctorate. So let me give her a little introduction. She's a licensed clinical psychologist, and she has experience working with children, adolescents, and adults to address a wide range of social, emotional, and behavioral issues. Her specialties include, but not limited to, anxiety, depression management, relationship concern, and transitional issues. And she have extensive background in the areas of psychological assessment, and she conducted psychological neuropsychological evaluation in universities. And she actually started her working as a group with a group of 6 to 4 people. I don't know
Mhm.
what was how, because
So right now,
on
my
the
group, there's about
Instagram,
seven of us. Hmm.
there was two. Yeah, that is some kind of group, and you people started working in during COVID time period. So I would like to know more about that, because according to my experience, when we work in the COVID time period, the stress level was very high, because the stress level was underlying, and people did not understand that they have stress, because stress is not just stress, it's about anxiety and depression as well. So in usual or layman language, it is stress, but our clinical concern is the stress is leading to depression or anxiety. So I would like to know about your working, and how do you started that group, and what was your experience of the COVID. Then side by side we will discuss about the stress management in working.
Yeah, so the group that I'm with, the practice that I work with, that's in Midtown Manhattan. Prior to COVID, there were six or seven of us. We all worked, side by side in an office suite right in Manhattan. None of us worked virtually. None of us did any kind of virtual telehealth session. But when COVID happened, we had to move very quickly and kind of transition very quickly to figure out how to make telehealth work. And it's interesting as a psychologist, as someone who's, a big portion of what I talk about on a daily basis is stress management and how to work through anxieties and fears and worries, but to also, while helping people work through that on their own, we also were kind of collectively working through the stress of and the fear surrounding COVID, especially those early couple of weeks when there was so much uncertainty and so much unknown. So it wasn't something we, could prepare for or had ever really learned about or trained for, as something like this hasn't really happened in any of our lifetimes. So it was definitely something that we had to kind of learn while doing, um, working through that collective stress, that collective trauma, and then also helping manage the stress that came along for our patients as they were trying to kind of navigate through this new life, right? Balancing responsibilities of work and home life all virtually.
Okay, so I think it was not just difficult for the parents, because those who were working at the home and they have to manage their kids, but it was also challenging for the therapist as well, because when you're working as a therapist, you have to do the session on on schedule base, and the client is waiting for you to talk about, like they always have, like I'm working with clients, and they always think that we are preparing ourselves for what will in our session, in our coming session. But when the COVID hit, and that was kind of a stressful situation for a lot of clients, because they were not able to talk to their therapist. So the transition was a little bit difficult for therapists as well, and when we are working as a therapist, so we are too much into one-to-one conversations and talking to each other, and developing the relationship. And there are a lot of things that when you are in a therapy session, then you don't you use your gadgets. So it's more like person to person thing. But when you transition toward the gadget thing, so that was a challenging thing for the therapist as well. And that was kind of thing that we all have to learn. And I think by doing this we learn a lot of things. a lot of good because that's how we met each other today, and we are talking to each other. And
Mhm.
I think that is a beautiful thing which we learned from the COVID. Um Beside other thing as well, that stress is a real thing and people have to talk about. And a lot of people who were not able to understand that they have anxieties and depression is in COVID situation, they it all arise, and I think they start getting that situation seriously. What is your opinion about that?
Yeah, I mean, I think for a lot of people, being forced to kind of really slow down and isolate really shone a light on maybe the areas that were particularly stressful or triggering. And I know with a lot of the patients that I saw over the past couple of years, what was happening was they were no longer able to kind of compensate or avoid areas of their life that they were unhappy with. Prior to COVID, when everything was just so go, 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 it was easy to say, you know what, this is something that I don't really like or is making me unhappy, but I could really avoid it by distracting myself and kind of throwing myself into this other area of my life. And I think one thing that came out of COVID was that everything was forced to stop. So we really had to kind of confront aspects of our life, even past traumas came up for a lot of people, things that they had never really processed or really dealt with. And while that in the short term probably felt pretty uncomfortable and pretty bad, to your point, it was probably some kind of a positive that came out of COVID, that there was a lot of good from a mental health perspective, and that we did have to kind of maybe finally slow down and really reflect or process or work on things that we really should have done a while ago.
Exactly. And let's come to our topic. Our today topic is as like you just like you just published your book about the ADHD, which was my concern actually because we just started talking about that. But I just gave you another topic that was about stress management. But we will do our that talk in the next week about ADHD. And the thing is that because stress management is very important, and for working mothers, because if we talk about parent at home, they say that they have different kind of level of stress. But when a mother is working, then she's always guilty about that she's not able to give time to her children. And
Hmm.
nowadays, like the world is so fast, mother and father both are working. So a lot
Hmm.
of population is, it's not like just by choice, it is by need. A lot of people who are doing job, they are just doing this just because of need, and they have no other choice because
Hmm.
everything is very expensive. They have to pay for the bill, they have to pay for the education, they have to pay for the food they eat, they have to pay for the luxuries, and they have to pay for the vacation which they are planning. So both parent have to work, either father either mother. But as far as the stress is concerned, mother is taking a lot of stresses. So I would like you to start talking about the stress, how you define a stress, a working mother stress, then maybe eventually we will go toward the stress management technique for the working mothers.
I think you're making a good point. Just to before I answer your question, because it's not just the stress of the working mom, and I think we should make a point about having inclusive language here, that it could be the stress of any working parent or caregiver,
Yeah,
right? It's
yeah,
competing priorities, and along with that comes a lot of feelings of shame or guilt or of not being enough or of not doing enough. And I think that a lot of that does get put on the mom in a very stereotypical family dynamic. But I think we have moved to a place where it really is true for any parent or caregiver. So I just did want to make that point, that even though we're referring to the stress of the mother, it really could be collective and shared among either any parent or caregiver. But a lot
exactly,
of what
exactly.
we hear about the stress of the working mom, I actually saw on TikTok, of all places, recently. Someone had posted a video where they were talking about the duality of the kind of like the competing pressures that are put specifically on women and how they don't make a lot of sense. And one of the points that this person had made in this video was that women are told to parent as if they don't have a job. And then they're also told that they have to go to work and focus on their career as if they don't have children. And that's a problem, right? That kind of pressure being put on anyone doesn't make a whole lot of sense because you can't be at 100% in multiple
Exactly.
areas of your life, right? That just logically, that just doesn't work. And when the expectation though is to act as if you're 100% present here, but also 100% present there, you're setting up an expectation that nobody can meet. And the pressure that that puts on the person can cause them to feel as if they're not doing enough, right? And then that from there kind of snowballs and can lead to feelings, like we said, of failure, of problems with self-worth, not being good enough, stress, anxiety. That in turn can flip into depression, and it can kind of continue spiraling from there. When I talk about this in private practice with my patients, I mean, the biggest thing here is really acknowledging how challenging it is to have competing priorities. In this case, we're focusing on work and childcare, but that is problematic because they are competing priorities. They both are extremely important in different ways and for different reasons. And so acknowledging that this is a challenge is really important. I think a lot of people want to or kind of shy away from that acknowledgement as if this is something that should be easy, or this is something I should be able to do. And that's really faulty thinking, right? Because the reality is that it is very hard. It's competing priorities, it's competing for your time, your energy, your cognitive resources, and that's really draining, and it's important that we acknowledge that. um, from there, what I usually suggest is also thinking about what's within your control versus what's not. And that's really important too, because a lot of times, and we see this across the board when we're talking about anxiety, is that the focus becomes, and we get very wrapped up in thinking about and overanalyzing and ruminating on things that are outside of our control. And when they're outside of our control, this is kind
Exactly.
of a useless exercise, right? That's even more draining emotionally and cognitively because there's nothing that we can do about it. So, where are the elements either in your day, within your week, within your routine that you do have control over? And making sure that that's what the focus becomes. It's almost like the non negotiables versus what's negotiable within the day, within the routine, within the structure. When you think about what's within your control, then you have to start asking yourself questions. Am I being realistic about the things that I can accomplish in a day? Right? Am I being realistic and logical about, let's say, the condition that I expect my house to be in all day or every week? And setting expectations that are reasonable, that are attainable, that are maintainable, and that are timely is really, really important. Excuse me. Oftentimes when I'm talking to parents and I ask mom, what does her daily routine look like? What is it that she's trying to accomplish within the day, within the week? Some of the things that they're trying to do either seem, it's a great goal to have, but it's not really so attainable. Or maybe we have to kind of I don't want to say lower the bar because that seems like we're lowering our standards. And it's not about that. It's about where can you give yourself a little bit of leeway? Where can you give yourself a little bit of grace just to make things that much easier? Another big thing that I talk about also is the mindset that working parents take, right? And a lot of times when I hear, the reflection back on what the day looked like or the week, it's a lot of really faulty negative thinking. I should have done this. We didn't do enough of this. I wish we could have done this. Well, if any one of us sat and thought back over all of the things that we could have done, right? But we didn't do, but we could have done or we should have done. We have no choice then but to be left in an emotional state where we're feeling less than, or we're feeling bad about ourselves, or we're filled with shame and self-judgment, right? Listen to that inner monologue, that inner voice is telling us you didn't do a good enough job. And we need to shift that because there's always something else we could have done. So instead of thinking, I should have done this, I could have done that, it's focusing on, okay, but what did you do? What were the things that you were able to do with your child not just today, over the course of the week, right? I also think expanding the time frame is important too. We don't want to isolate and just look at this one specific day. This could just be a bad day, and that's okay. What did you do, and what was meaningful, and what did your child enjoy in the time that you spent together? Along with that, I also emphasize a couple of key points in the time that you are spending with your child or your children in making that as meaningful as possible, right? Along these same lines. What did you do? But also, how did you do it? Let's look at the quality of the time spent together versus maybe the quantity of time. Because, I did have to go to work today, or I did have to work 4 days last week, 5 days last week, and that took away from the time I could spend with my child. So let's look at the quality of the time. I always emphasize what's called empty hands listening. And this is a communication tactic that you could use that's good not just for kids, also with spouses and anyone with a meaningful relationship, but especially with children, in trying to really aim for that meaningful connection and that quality time. And all this is when you're with your child, when you're talking, when you're interacting, when you're playing, have empty hands, meaning no phone, no laptop. You're not cooking. You're not also folding the laundry. And you can't do this for 12 hours of the day, but make sure that there are pockets of time where you're 100% focused on the interaction with you and your child. That makes it meaningful. That helps strengthen the connection. And that speaks to, what did I do today? I was able to give my child those 10 or 15 minutes throughout the day where it was just us. There was no, I have to wash the dishes. I have to get this done. I need to multitask. Of course, that's going to happen and that's okay. But there are these moments where it is this empty hands listening. I'm completely engaged and we're one on one. So that when you're looking back and having that reflection, again, you're focusing on not what I didn't do or I could have done or should have done, but what I did do. We had this really great 10 minutes where we just played or we just talked and I wasn't distracted by, other competing priorities.
Exactly. So I think you give a very good idea, and it could be anything you're spending time with your child. It could be a reading time, uh,
Mhm.
bedtime stories. It could be anything. And the thing is that this should and could have, destroyed a lot of houses, a lot of societies, and working on the expectation of society, we certainly forget that we have to work for ourselves as well. So whenever you're talking to the working mom, they always think that we are not, you could say, we are not strong enough, or we are not, when it comes to our child, and we're not there present, because when the child is born, that expectation is different, or you could say the child needs are different, but the moment the child grow up, the needs grow up with the child as well. So sometimes doing job is not an option for you. Like, you have to do the job. It's not that you are doing job or you're not doing job. Sometimes it's you have to do the job because you have to, look to the expenses of the family, and there are other such circumstances as well. So sometimes it's your need that you are doing the job for the child, and you have to like before marriage you are judged for the reason that you don't have a child, or you're not getting married on the time. Like, there's a lot of things that you're being judged for, but the thing is that just looking to the expectation of the society, sometimes you just don't forget that sometimes giving the quality time, just like you said, that quality time is more than enough. Giving that the time, that sometimes you're doing a laundry and children are crying, and you are just, getting stressed just because the children are crying without any reason, and they don't find anything to do, and you don't have a schedule to follow. So putting things on the schedule is very important for the child. And the level of the stress, I guess, different when the child is, the neonate, and the child get grow up with the time. So with the passage of time, I think uh, we have to adopt the phenomena, or you could say we have to adopt to the thing that now we are not living in the old days where we were living in the, joint family system. Now a lot of systems are isolated system, like in our countries, because from our we both are living, we both are from different societies, from different cultures. So child rearing practices are different, and maybe like you said, the caretaker, the concept of caretaker is very new over here. And maybe I have seen a lot of parents, lot of working parents who are sending their children to the daycares, and that is costing these children a lot. I mean, I have seen children just suffer a lot because of that, because there were a lot of malpractices over these days daycare. But the thing is, over there is the stress is going to remain there for mother. Even the child grow up, and she will always think that we are not able to enough, we were not present for the child. And okay, let me give you another question. Like you said that it is about the parent, whether it's a mother, whether it's the father. Do you think that the stress level of mother and father is changed if we talk about? Because usually it is thing, whether either it's west or the east, like in both culture, a father has to earn for the family. Like he don't he think that, or people or society think that, no matter how, you could say how modern we are, still society think that the father have to earn and mother is responsible for all kind of, character building of the child, and looking toward his food, looking toward his, education, stuff like that, and father is out there to earning. So do you think the level of the stress is different between mother and father, that how much time they're giving to the child?
I mean, I definitely think that there are some old, I guess, stereotypes where, the mother is the primary caregiver and dad is the breadwinner. But I do think, at least in our culture, that there's been huge strides in how that's looked at, right? Most households nowadays, there are both parents are working. Moms do have careers. They are kind of balancing both childcare and a career. But I do think that it does still typically fall on the mom, some of the stress of the child raising, whether it's just the decision making, or the actual child raising. But I don't think that it's I don't think that that's like so normalized as it used to be. I think, the households look very different now, right? It's not always just a mom and a
So you know
dad
what?
and this very kind of domesticated relationship with those domesticated roles.
So you know why I discuss this? Like a day before, just like yesterday, we were doing having a discussion, and we all consider, or we all was working. Few were married, few were unmarried, and we all consider on the point that no matter a mother is working, like I, my first question before that was like a mother is now working because she have to work. Like it's a need. It's not a a choice by career. In our areas, in our country, the career is not a big thing for a woman. Like she have to study, and then she have to make a family after that. So job is coming in between. And it's not in very few houses, you could say in few places or in cities, you could say that people are have this kind of concept that a girl should have a career, a girl is working for her career, and she's making, at the end of the day, she's making a good amount of money. So a super primary person who is balancing everything, like balancing between the husband and wife relationship, balancing between the in-laws and the
Mhm.
daughter-in-law relationship. Like she have to do a lot of things. Like just let me give you another example. In the morning she have to wake up, other people are sleeping, and she have to wake up so early. Like she have to wake up so that she can make a breakfast for the whole family. Her needs are also met, and overall her day is so busy and so hectic. I mean, whenever she will come back, she have to make lunch maybe and do a lot of things. So it's her job. It's more like 24-hour job plus additional
Mhm.
burden on her. So at the end of the day, she have to do her laundry maybe. She have to look into the education for her of her children as well. So and a lot of expectation on her, and they don't understand this idea that as well. She's my board. And
Sorry, Dr. Khan, you keep freezing a little bit. I don't know if it's just my internet.
No, it's okay. I think both internet is just like that. But when we both are talking to each other, it gets freezing. But our audience can listen to us. So you just keep on talking. If you don't listen to my voice, you can ask me to repeat the question. Okay. But they can see us on their side. It's okay. But I think it's going live, so maybe that's the issue. So did you get my point? What I'm trying to say you that a mother is working and she have to look into everything, so that stress level is heightened, and
Sure.
she is suffering in silence. And the thing is that she cannot take help also. She's not able to take help because uh, the moment she will talk to her husband, the husband will say, just don't leave the job, just leave the job. I mean, they would say
Well,
that they would start complaining.
I think that there's like some truth to what you're saying, and I think it's again, it's not just the mother; it's whoever is in that role, right? Really taking on maybe the bulk of the house or the childcare duties, and also trying to balance a career. And it could be the mother. It doesn't always have to be. There's not always a mother in the home, right? Nuclear families could be made up of many people taking on these different roles. But managing that stress, to your point, is really important. And the parents or the caretakers, their mental health being intact is really important for the children. One,
Exactly.
having good having your own good mental health and being mentally healthy is going to make you a better caregiver, right? It's going to make you better able to manage the multiple demands and tasks of being a caregiver, as well as managing a job or a career. It's also going to help you be more present, right? Be more patient, be more understanding, and you're also modeling healthier mental health and emotional habits and behaviors for the children when your own mental health is taken care of and intact. So it's really important that stress is managed in all caretakers, not just the primary one.
Exactly. And the reason to do this, doing all this session is just to give them awareness. If the moment that they think that they are losing their losing themselves or losing their sanity, so-called sanity words, so they should
Mm-hmm.
ask for help, they should seek help. I mean, suffering is silence
Absolutely.
is not an option. Like, if you're saying that you
Absolutely.
have to work, is not an option for you, then you have to take care of yourself, because nobody else is coming to take care of you. You're the one who is suffering, and you are the one, because children are depending on you.
Mm-hmm. Absolutely. Asking for help
If
can be
something
a very
happened to
huge
you,
hurdle, but it's a
something
really
happened to your
important
mental
step
health,
to
and
take.
you just go into deep, and you have to take medication, and the extreme level of depression, which is very clinically significant, or extreme level anxiety, and you start, it costs you physical and mental health both. So the moment you feel that you have to take care of yourself, and you have to talk to the
Mhm.
doctor, that what I'm going through, how can I manage this thing, and how can I manage the role, because uh, over here we even don't talk about priorities. We are talking about the mental health, which is important, whether either it's husband or either his wife, either it is the primary caregiver or it is the second caregiver. Even if you're not taking care of yourself, then the thing is that your children are going to get into extreme, you could say, guilt, that our mother is doing for us. Because I have seen these children, and they say that we are so guilty that our mother have to work for us, and she's working for, and we're not able to take care for her, and she's just ill because of her, because she have to do this, and she have to do this, she was doing this, and she was balancing everything, until a day came where her pressure point is collapse. So
Mhm.
she is the pillar of the home, she is the pillar of the society even. So if she think that she have to take care of her children, she have to take care of herself, because over here we are not even talking about shoulds, and so even we are not, we both are not even discussing the aspect of society. We are just discussing the whole personality of a woman, that need to
Sure.
be, you could say, in the balance, and this is how she's going to attain this balance. Okay, let's move toward the management techniques. We talk about a lot of circumstances, it could be different factors for a woman, and even in different societies. And I think it's not about even maybe problems of mental health the same everywhere. And you could say managing techniques are very important, and like other skill, and like in the start you're talking about, parenting is not an easy thing. parenting is difficult, and we don't even have a manual for that thing. We cannot teach everyone parenting. I mean, it's difficult for us to, you could say, do such things, because uh, these are something which you acquire by the way you were parent, you were raised as a child. That's coming from the society. But the thing is that what we could do is talk about management skill, talk about coping skill, talk about skill how to manage their time, which is very important, or how to have a schedule, how to have a quality time with the children, and how to have a, quality time with your
Mhm.
husband. Sometimes they are doing everything, and they are, you could say, their marital relationship is suffering a lot, and that's
Sure.
all because they are not able to take care of themselves. Like, it's
Mhm.
not just about your, it's about your spouse as well. So neglecting all of them is difficult, and it could cost a lot at the end of the day. So let's go toward the management technique. So how you can start management, and how a woman, she came to you and she just tell all the problem which we discussed, like the jumble of problems, how she can start managing her stress. I'm specifically
Well,
talking about working moms.
right. So, what I always kind of start with is making sure that the women's physical and mental health is set up for success, right? And a starting point for me, I refer to it as the mental health trifecta, right? Three components to make sure that at a baseline, you can be at your best. And that's going to include having some sort of, I call it an exercise regimen as step one, but it's not really so much about exercise as it is about body movement, right? Like just making sure that you're getting up, you're walking, you're stretching, you're doing things to kind of get your body physically just going, right? Not necessarily a whole like workout routine, but I'm talking about all aspects of body movement as kind of step one. Step two, I'm looking at a support system, right? This can be friends, family, coworkers, it could be a spouse, whatever it is. But really making an effort to have that social network that you can lean on for social reasons, but also for support when you feel like you need it. And then the third one is just the overall healthy routine. And this is making sure that you have everything incorporated, healthy sleep patterns, good eating habits, hobbies, activities that you enjoy, some kind of structure to your day, right? This is kind of, to me, the basic components of putting together a good mental health regimen, right? Once that those couple of things are in place, right, we're making sure that we're taking care of the working mother, then we can start to look at things like how I said before, I move usually to what I call the ACA model: acknowledgement, control, what's within my control, and then acceptance. So we're going to acknowledge the challenges that we're facing, right? Maybe we're acknowledging that this is a really busy time of year at work, and it's demanding a little bit more of my time and attention right now. I'm a little bit more tired at the end of my day because of what's happening at work. Or maybe my child, my children are going through a really demanding or difficult phase, and that's pulling some more of my energy, right? Acknowledging the reality of the constraints of the trying to balance work and being a mom. We have to acknowledge that, like I said before. Then we're going to focus on what is within your control, because those are the things that maybe you can change. And maybe once we identify what's within our control versus what's not, we can look for things like, do I need to ask for more support? Do I need to change the structure or the routine of my day? Do I need to change my expectations for what can happen in a day versus over the course of the week? All of those points that I mentioned a little bit earlier. The last step here is acceptance. And this is another big one because we have to accept the reality of our situation. And acceptance makes things easier because we're not fighting against it, right? Okay, so right now things are a little bit more stressful or a little bit more difficult, but I wish they weren't. That's not making things any easier. That's just putting more negative pressure on the situation. So accepting that, the next couple of weeks are going to be really busy, or the next couple of weeks are going to be really challenging. This is a really difficult period. I feel like I'm really struggling. Having that sense of acceptance takes a lot of pressure off of the situation, which can right there can help alleviate stress. So before I even get into coping techniques for stress management, these are the two processes that I kind of work through just to kind of line everything up. We have to get all of our ducks in a row before we can actually start with working through the stress, because we want to make sure that what we're focusing on is actually the core, the root of it. So that mental health trifecta, the exercise, the social support, and the routine, and then working through acknowledging the reality of the situation, focusing what is within our control, and then acceptance of the reality kind of sets us up then for, okay, now let's work on stress management. And once I get into the stress management piece, I can recommend a couple of steps. One is behavioral, right? So you're feeling really overwhelmed. You're probably feeling, you're feeling it physically, probably in your body, whether it's kind of like a tightness in your chest, some real muscle tension, racing heart. You could be feeling, sweaty palms, maybe some kind of gastro discomfort, that type of thing. What are coping mechanisms that help physically relieve tension? This could be the exercise routine. This could also be some kind of yoga or mindfulness strategy, some kind of meditation, deep breathing that's going to get you a couple of minutes where you're focusing just on yourself and taking like a mindful pause, deep breathing, relaxing that nervous system to bring everything back down to baseline, right? We want to reduce heart rate. We want to reduce your core body temperature that's been elevated because of the stress. So a couple minutes of deep breathing, a really nice meditation can help relieve some of that stress and bring everything back down. So that's kind of the behavioral piece. And I really like meditation and mindfulness for this because these are things that you can do. They're very quick. And if you're already juggling work and taking care of the house and taking care of the kids, the first thing that patients come back and say to me is, I don't have time to take care of my stress levels. But if you're doing meditation, if you're doing mindfulness, you can do that. It's 2-3 minutes. Could really make a difference in your stress level, right? If you are, I hate the metaphor of the pot of boiling water, but it's a good one. But if you're at a simmer, 2-3 minutes can bring you back down, can cool you off. And that's something that everyone can find 2 or 3 minutes in their day, throughout the day, to do a couple minutes of deep breathing, a quick mindfulness or meditation technique, and that can really make a difference in calming things down, relieving some of the stress, and coming back down to baseline. That's the behavioral component. I really stress in my private practice work with patients the cognitive piece, because I think that the lens that we're looking at the world through, and the perspective that we're taking, and the language that we're using to describe our experiences is so important. If we're looking at things, and as I've mentioned, as we said, I should have done this, I could have done that, we're talking ourselves into a negative state, right? We're saying, I failed, so we can't possibly feel good. That's just going to create more pressure and more stress. And so I really encourage the women that I speak to look at the language that they're using. If you're using words like I could and I should, I could have, or I should have, replace that with this is what I did. You want to make sure that you're not looking at things through a mental filter, such as black and white thinking, right? If I don't do this today with my children, this is not a good day. They're not going to have a good day unless we do this activity, right? You're setting yourself up for a negative mental state. And you're setting yourself up to really increase your anxiety levels when that's the way that you're looking at your chores in your day and your tasks. So making sure that you're using language that doesn't create anxiety in the absence of any triggers is really, really important.
Okay, so I really like the way you describe everything in very in detail and stepwise. But I think over here one thing is important: is time management is very important, because I think what I always feel about even depression, anxiety is time management and schedule. Both are very important things, and it is going to save a lot of time for you, because whenever you're in happens at a situation, you're just going into stress, and that is kind of you're just giving yourself stress. And the other thing that like you mentioned in the last is self-talk is very important, and negative self-talk is going to give you a lot of anxiety, because a lot of time maybe people are not even thinking that about you, and you're just feeding yourself these kind of, because this should and could have are coming from the society you are born in. And a lot of time those people who are passing these comments, who are passing these judgments, they're not even able to do these things by themselves. Like the way whenever you look into their life, the way if you look into their household, maybe they are in a disastrous kind of position. So judging you and not being able to show you something, if they're not helping you, maybe you don't need to talk to them. Maybe you don't need to ask for help. And if you are really having some kind of issue, some kind of stress, counseling is the best option for them. If you think that you don't need a therapy, because it is still a stigma that going to psychologist, and it's still a stigma. But I think taking some time for yourself, taking a little break from the people, even it's very important for you. And working on yourself is very important. Like meditation is important. Maybe you cannot have a lot of time for exercise, then doing some kind of yoga and things are very important. But at the end of the day, you are the one who is going to do all of this. People can give you a lot of uh, points you should do, and you can do that in the sense of I'm using should or could word again. But we all are there to help you, we are all there to give you some skill. But at the end of the day, it's you who are going to change your thing, and who are going to work on your stress. Okay, I have two important questions.
I just want to respond to that really quickly, because I think you bring up a really good point about the judgment that others are making, and I have 2 points there. One about the judgment of others, and then one about self-judgment. And the judgment of others, sorry, I'm making a note so I don't forget my point. The judgment of others is important to consider, because how do we know that other people are judging us? And this is a big one with working moms, right? How do we know? It's one thing if people are saying to us, they're making a comment directly to us, right? But in the absence of that, how do we know that other people are judging us? A lot of times that insecurity and that concern that other people are of what they're thinking about us or what they're saying about us is not coming from the other person. It's coming from something within us, right? So when you're in a moment where you're assuming that someone is thinking something about you or passing judgment, I want you to ask yourself the question, how do I know that this is true? What's the evidence that this person is passing judgment on me? Right? Because unless they explicitly say to you, I'm passing judgment, or, I'm judging you, or I have this negative thought about something that you're doing, usually this is just our anxiety playing out in this way. And so, you want to ask yourself, how do I know this person is actually passing judgment? And if they are, let's say they are, right? Does it matter? Does what they think mean that if they think something negative about me, does it mean that it's true? Does it mean that everyone is thinking it? And can I handle it? Can I handle this one person having a bad opinion? Sometimes we're so afraid of the possibility that someone has a negative opinion of us that it handicaps us, and it almost becomes crippling. When if we really kind of pull at that thread and play that fear out, at the end of the day, we say, you know what, it doesn't really matter. That's something that I can handle.
Because you're according to you, or your set criteria, other people are acceptance matter to you that much that you start hating yourself, and you're not even accepting yourself. So it means that other acceptance is more important for you than acceptance of yourself. Okay, you just brought about that judgment, and there's a very important question in my mind, because I'm working with children as well. And the thing is that a day before yesterday, one of my colleague gave me one was talking to me. She just said that wait, sorry, 12 minutes. Come after 12 minutes. I think I need to unmute myself.
Oh, you're muted. Dr. Khan, you're muted.
Now?
There you go. Yeah.
Okay. So, I'm not muted. Can you hear me?
I can hear you. Yeah.
Okay. So, you because you're also working, you just work on your book with the ADHD, and the child was maybe, I think the child was autistic or ADHD, some kind of somehow it was on the spectrum, and the child was having some kind of meltdown, and the child was crying during the whole session, and that was a hospital. Other mother was sitting, and they were in the waiting list, and they were sitting for the child to have session. And during the session, that mom come inside the room, and she was talking. She starts nubbing her child that why you're crying, why you're crying today, what I'm going to tell to all the other ladies that you are crying today. So just coming to the point that I'm talking to a parent who have a special need children. Let's talk about the stress of those mothers. And the mother have a child who has special needs, who have different needs, who have additional needs, and she's also working. So how a mother can manage her stress? Like I just give you an example that she was so stressed that she don't even get the idea that what she's doing. Like she's just coming in the session, she's just disturbing the session. And don't you think so? The other children also, other parents also listen that what she was saying to her child. So that was her burnout actually, and uh, what she could do about that? I mean, what a mother who can do about her stress?
So with children with special needs, we're talking about such an added layer of stress. And for these parents, I really, really do stress and advocate for the importance of their own counseling. And this is twofold, because I think that these parents and caregivers would benefit, one, from individual counseling, and also
Exactly.
from a support group or group therapy.
Exactly.
And
Exactly.
2 points here, right? One, the individual counseling, because this is really stressful. These parents are at such a high risk for burnout. They're at such a high risk for developing anxiety and depressive disorders. Part of that counseling really should involve grief work, because these parents are on a grieving process. They are going through a grieving process, right? They're grieving the loss of maybe the future that they saw for their child, or they're grieving for, the whatever type of kind of losses this child is experiencing, as compared to like their peers who don't have special needs, and that in and of itself really requires individualized therapy. That's a huge part of being a special needs parent. There's going through this grieving process, and then of course accepting the child for who they are and where they are, and also just having that support as they kind of go through the caring process. It's very stressful, it's very overwhelming. It may also involve like a new language depending on what the disability is, right? Medications, needs, physical therapy, occupational therapy, whatever it is.
As well,
So
because
that's
like I
really
mentioned, that
exact.
she have to work for her child because she have to pay for the therapy. So it's a big
Mhm.
burden, and you're very much, I think, right over here that group therapy is very beneficial for these parents. And like I'm also doing like on weekly basis, I'm also having support group. So it's kind of sometimes I give them training, and they just share the problem. I think the idea of group therapy is always that they feel that they are not alone in the world, and every other
Exactly.
children have other parents have that issues, and they all are going through the same thing. Okay, let's talk
Exactly.
about. Thank you
That
so much
group
for your
therapy is really powerful, right? Because
exactly
it's
very
there, it's
powerful.
powerful. It's, to your point, you're not alone. There are other people who understand exactly what you're going through, or in a
Interactive way,
comparable situation. Mhm.
exactly, and that is in interactive way, because somebody they don't want to come for the individual therapy, because people are still afraid to come to therapy. But if you come into group therapy, then the stigma of coming for the therapy, because they say our child have issue, we don't have issue, we are okay, you don't need to talk to us. Because whenever we ask parents, sometimes they don't come for the therapies, or sometimes they don't come for the session, or they don't come for the PTM which we established for them. But when it's a
Mhm.
group therapy, then a lot of parents are coming toward that thing, because they see that other parents are also there, so they somehow find that courage which they lost maybe to
Yeah.
eventually come for individual therapy. Okay, I would like to ask you another question, and after that we will complete our, you could say, conclude our discussion. Let's talk about those mothers who are single and who are divorced. So what is the stress, you could say, the level of stress they have, and how they can manage their stress? Because now the working is option, it's not an option, it's the need. Because maybe throughout the discussion I'm talking about those parents who have to work, just because there could be multiple reasons of that working. So over here there is a single mom who have to take care of her children, and it's a divorced mother, and it would that we also mean separation, or maybe the spouse is not there anymore. So what is stress, their stress level, and how they can cope up with that stress?
I mean, I think the stress here can be the same. I mean, the the financial struggles of whether you're single or married or with a partner or without, um, that could vary regardless of the relationship status, right? So those stress levels, they have the potential to be the same or worse regardless of if you're a single parent or not. Of course, if you're a single parent, there may be a lot more responsibility, a lot more that you're trying to manage just because you are one person. And that's where being able to ask for help is going to be really important. A lot of people really struggle with being able to acknowledge that they need help or advocate for themselves that they need help, whether it's from the partner or even if it's from friends, family, neighbors asking for any kind of assistance. And being able to do that definitely takes courage. It definitely takes the ability to kind of speak up and advocate for yourself. But it's really, really important to reach out to your village, right? Your supportive network to get the help and assistance that you need.
Okay, so over here you are saying that, like you said, the village, so they need to go to their family member to have that support, because to give them, you could say, moral courage or the other support they need, because at the end of the day, uh, those people, I mean, like people say that you cannot buy everything from the money. Like you cannot buy a stress-free life from the money. You cannot buy a problem-free life with the money.
Mm-hmm.
And luxury doesn't mean that you don't have problem. The stress level will be there, because a lot of time it's not about the situation you have, it's more about the person you are, it's more about your, you could say, coping strategy. So the situation would change, the people would change, because maybe sometime, we are working in a place where people are giving you stress, like, it's not just about society judging you, it's about the people you're working, they're also judging you, the peer group you have, the spouse you have, maybe the siblings you have. Maybe you can get that feeling from anywhere. So if you think that you can change the environment, by changing the environment you're going to be have a stress free life, I think it's not possible as human being.
Mm-hmm.
Maybe you go to some other place, the people will remain same, because more or less people coping strategy, or people talking to you, and people the way they they see different thing, because the people they see the motherhood, it might be same everywhere. How do you raise your child, these practices might be remain same. So at the end of the day, it's come to you that how
Mm-hmm.
you're going to work on your coping skill. So over here, stress will, because at every age of life the stress would be different. I mean, if you are young, the stress was different. When you were not married, the stress was different. When you are married, the stress is different. When you have children, the stress is different. So you cannot have a stress free life, it will remain there. But the thing is that you have to work on yourself, like we just throughout the talk we talk about working on yourself, work for yourself, because I don't think so we don't have any other option. It's not an option to just sit down and a bit happen and just situation get changed. I don't think so that it is
Mm-hmm.
possible. So seeking some help, taking some help is not bad thing. We have to break the stigma. We have to break the stigma. We have to break the stereotype of mental health. That if somebody is taking mental health, that they are some kind of, you could say, they are crazy or something like that. Because still in this age, in 2022, people still don't tell other people that. And I'm working with a lot of patients who don't tell their siblings that they are taking some kind of mental health help or counseling. A spouse, they're not even mentioning this to their spouse that they're taking some kind of counseling, or you could say mental health or professional help. So I think by maybe by telling them, you could your situation is different a little bit, and the life get easy for you. Maybe they start supporting you, and they start coming toward you and start supporting you in the way, maybe they start looking toward you in different way. So I think that's all for today. Thank you so much, Dr. Nicole, for your time, and I would like you to conclude the whole session. Then we will say bye bye to the people who are looking toward listening to
Thank you
us
so
with the
much for having
patience.
me.
So, is there anything you want to say in the last? By the way, our next session is pending. That will be an interesting session for us.
Yeah.
That will be a different session,
Next
by
time
the
we'll
way.
talk about parenting children with ADHD and kind of tips and tricks and that kind of thing. Yeah, I think here just kind of, key points is focusing on what's within your control, not judging yourself, giving yourself some grace, and remembering that you're the best parent for your children. And letting that kind
I think
of
that is the point.
be letting that kind of be your mantra and your guide, that it's stressful and it's challenging and we're acknowledging and accepting that, but you're still the best person to parent your children.
And the thing is that what you just said in the end, I think maybe a lot of parents want to listen to them, and nobody's telling them that they're good, they're doing enough. Whatever they are doing in their limited capacity, they have done a lot for their children. So thinking that we are not able, we are not enough for our children, and we cannot do this, and other parents are doing this. Believe me, everybody have their own struggles. Everybody
Mm-hmm.
have their own monsters. Everybody have their own stress, which they need to tame, which they need to work for, and which they need to work through. So just you know just relax, I would say that, and just happy that there are people in the world who still still want to have the life you have. And I think gratefulness and staying happy what you have is the best thing, best message we can give. And thank you so much for your time today, and we will see you in another session very soon next week. And signing off for today. Thank you so much.
Okay.
Bye.
Thank you. Bye.
That was nice talking to you.